Welcome back, dear viewers, to a new episode of DocTalk. Today, we're going to address a very interesting topic. Some parents neglect it or oversee it. It's snoring and sleep apnea in children. I know it sounds unnecessary or not important, but it is very important for children, especially in their growing years. And today we have with us Dr. Abeer Alali. She will guide us and walk through with us in this subject to know the symptoms, the dangers, and how to treat it so that children will grow healthy. So please stay tuned after this short break. Welcome back, dear viewers, after this short break, and welcome again, Dr. Abeer Alali, to DocTalk.
Thank you for having me again. Thank you so much.
It's our pleasure. So let's jump into business. Let's talk about the difference between snoring and sleep apnea in children.
So snoring and obstructive sleep apnea, upper airway resistance syndrome, this is all a spectrum of what we call sleep disordered breathing.
Okay.
So sleep disordered breathing means that any issues or trouble of the airway and breathing that occur during sleep. So it can be, and that's why we said it's a spectrum, because it can range from simple snoring, meaning everything is fine, the kid is breathing normally, but there is a little bit of turbulence with the breathing. So there's, let's say, the sound of snoring. And there is the extreme or most extreme version of it, which is apnea, meaning that the airway blocks or the child stops breathing during sleeping time. So it is a spectrum, and it's something that we should not overlook because there are consequences that that come with these conditions.
Okay, at what age these conditions appear in children?
So they could occur from any age for different reasons. So we have, they could be very young, as early as newborn, although the majority of the cases are, let's say, in the toddler age, meaning from around 12 months to, and onwards. In smaller children, or let's say even in newborns, they could have these issues, especially if they're kids with syndromes, meaning that they have other medical issues, other anatomical issues that play a part in this. However, the majority of cases, as we said, occur from 12 months and beyond.
Okay, let's talk about the symptoms. What are the common symptoms for these conditions in children?
So in terms of symptoms of obstructive sleep apnea, or let's say sleep disordered breathing, as we said, it could be a range from simple snoring, meaning just noisy breathing, or pauses in breathing. And I do have some parents that come to me and they actually witness their kids with pauses. So they come and tell me that I have to shake my child or wake him up for them to get, a breath again. So those are the direct symptoms that we see with sleep disordered breathing.
Okay, what kind of effects that this kind sleep apnea or snoring can cause on children?
So before we talk about the effects of sleep disordered breathing on children, I would like to just talk about a little bit of the physiology of sleep.
Okay.
So it is very important that we know that the sleep is a very complex mechanism.
Okay.
Subhanallah, it is very, very delicate and complex. And
it's very simple.
It is. You just see a patient, a person that is lying down and sleeping, but it is definitely a very complex mechanism that occurs. And they're divided into, let's say, roughly into deep sleep and let's say normal or lighter sleep. So it is important for us to understand that during our day, we work, kids study, they play, they're active, even our metabolism, this all creates stress on the body. And the only time that the body recovers is during deep sleep.
Yes.
So if the kid does not sleep properly, or the adult does not sleep properly, so then the body does not recover.
Okay.
So this is very important for us to know that if the body does not recover, in adults, they develop cardiovascular diseases. In children, they develop other. And I always say that, alhamdulillah, God protects the children so they won't develop very early, cardiovascular diseases, but they will have developmental issues. And it's very important to know that these, a day in a child's life is very important because it is a lot of information that they acquire.
Yes.
They learn a lot during one day. So imagine one day difference in a child's life will impact them. So the symptoms, or let's say, sorry, not the symptoms, the signs that we can see in kids who have obstructive sleep apnea, let's say that they're not direct signs, but we could see kids who have, for example, hyperactivity.
Okay.
And we think that there are ADHD.
Yes.
Or some kids that have very poor concentration. Or suddenly a kid that was doing well in school and now they're going downhill.
Yes.
So they're not, you know, academically their performance is not that well.
Yes.
Surprisingly, and again, this is very, very common, and a lot of people misdiagnose it, is nocturnal enuresis, meaning that when the kids start sweating their bed again.
Okay.
So they're completely clean, and suddenly by the age of 8 or 9, I have patients who are even 10 years old, they start, you know, wetting their beds again at night. So those are all signs that could be strongly related to obstructive sleep apnea.
So that, as we call it here in Kuwait, zan noma zan yoma. Good
Exactly.
sleep, good day.
Right, of course.
Okay, let's talk about physical growth for children. How does sleeping and, let's say, snoring affect children physically? Especially now we are going back to school, and as you say, there are a lot of kids wetting their beds, and that consequently affect their performance, their social habits. Does these diseases have long-term effects on children?
Well, definitely, and that's what we said, because first of all, the symptoms, you know, first of all, it takes some time for the parents to be aware and make sure that, okay, this is a condition where they need to see a doctor. So by that time that they reach the diagnosis, or let's say that they reach medical attention, it's been a process that's been going on for some time.
Yes.
So we do see at that point that a lot of kids do have these, you know, delay in their academic performance. They have a lack of concentration, hyperactivity. They're tired kids. You see them that they're tired. I've seen a lot of kids that they have, you know, like dark circles around their eyes. They have what we call adenoid faces because they have, you know, most of them have nasal obstruction. So they're mouth breathers, and that's why their mouths are always dry, and they have what we call adenoid faces, mean that their sort of chin grows downward.
Yes.
So they do have a characteristic. Again, it's not something that happens to all kids, these features, but we can tell a child that is not sleeping well also just by their appearance in majority of the cases.
Does it lead to obesity and diabetes, sleep apnea?
So in adults,
studies,
definitely. In kids, however, there are not studies that showed that obstructive sleep apnea does lead to obesity. However, we know that obese kids, the majority of them have obstructive sleep apnea.
So the majority. So we need to make sure that the kids, you know, when we used to be kids, our parents always push us to go to bed early. Now, as adults, we wish to go to bed early.
Yes, yes.
Okay, let's talk. Before that, you talked about the medical intervention. Is there a medical intervention for children?
Well, there are guidelines that we follow, especially as pediatric otorhinolaryngology. Usually, kids who are under the age of 2 years old. Usually we try to treat them conservatively, meaning with medication. And basically those treatments are just nasal sprays to try to reduce the adenoid sides. In some cases where it works, then fine, we did reach our target. If not, then we have to address that surgically by removing the adenoids.
Yes.
According to the guidelines, it is usually we try to not remove the tonsil tissue.
Yes.
Unless I have done a sleep study.
Okay.
For those who are under the age of 2. Over the age of 2, any child over the age of 2 who has clear symptoms of obstructive sleep apnea, we usually treat surgically with adenotonsillectomy.
Okay, Dr. Abeer, it's a very interesting topic. We're going to keep talking about it, but right after this short report, so please stay tuned. Welcome back, dear viewers, after this short report. So now we continue with Dr. Abeer. Let's talk about the risks associated with the sleep apnea and snoring. Sometimes they say it affects the vocal abilities for children. Is it true or not?
No.
Okay.
However, it does change the resonance of the voice.
Yeah.
Because again, when we have tissue that is obstructing the airway, the nose and the oral cavity. Usually the air that passes through the mouth to the vocal cords to vibrate the vocal cords pass in a certain way that is different when you remove the tonsils. So I always like try to simplify it for the parents. Like when you have a room that is filled with furniture, and then when you remove the furniture, there's resonance.
And there's
echo, as they say. Sorry. So I try to simplify it in this kind of sense that when you have tonsillar tissue, definitely the voice would not be the same when you remove the tonsils. So it's just that the voice is more clear, it's more natural. When you have tonsils, the voice is more stuffy, let's say, but it does not change the vocal cords or the function of the vocal cords. It changes the resonance of the sound. Yes.
Okay. Now let's talk about parents. How do parents distinguish these symptoms from snoring? Okay, snoring, we have the symptoms, but how can we know it is a serious problem now?
So again, this all depends, and again, we cannot emphasize enough on the role of parents with their children and how they need to take responsibility and follow on their children and not just let the maids and housekeepers take care of the children. It's because when a parent notices that their child snores, so they would say, okay, the kid is snoring, but then they see it's every day. And then the snoring is increasing. And then eventually by, as they say, the gut instinct of a mother, she would go into her child's room and say, okay, like what's going on? So then at this point in time, they might identify that, okay, they're snoring and that there are pauses that occur during sleep or like abrupt movement or like, things that are not normal for a kid to, for a normal sleeping pattern. So when these symptoms occur, and then the mother obviously would be worried, and then they would seek medical attention.
Okay, let's talk about now children. Does overweight kids have more problem than normal kids?
So we know that obesity is not a cause for obstructive sleep apnea, but it is an association, meaning that kids who are obese usually will have obstructive sleep apnea, but we do see very slim, thin children with obstructive sleep apnea. So there is an association and it's not causative. Okay, so, but again, children with obesity and who have obstructive sleep apnea sort of have a different pathway in their management. But I'm talking obese and not overweight.
Okay.
So when we talk about obesity, means we have a particular body mass index that we consider to be overweight for children, or obese in children, and therefore they have a different pathway. Obese children with obstructive sleep apnea, we always have to have a sleep study done before the surgery, because we know when we do the surgery, it is a 50-50% chance of curing the disease. Because sometimes we do the surgery for obese kids and nothing changes. They still have the obstructive sleep apnea. And sometimes we manage to cure them. Therefore, it is very important to do a sleep study before, so we could know the difference before and after surgery.
Let's talk about the sleep study. Explain it to me. You have a case, and now you need to do a sleep study on that case. Take me through it.
So first of all, sleep studies are only done in particular scenarios. We don't do it for every child because, and believe it or not, this is it's a worldwide issue, that access to sleep labs is very limited. Even when I was back in Canada, it is very difficult to get a sleep study. So therefore, we have a certain criteria for those who need to do a sleep study to diagnose and book them for surgery. And those are kids with obesity, as I mentioned, kids who have craniofacial anomalies or syndromes, let's say, especially, for example, achondroplasia, Down syndrome. So those kids need a sleep study before we do the surgery. We have kids who have, let's say, disconcordance between their symptoms and their clinical presentation or physical examination, sorry. So let's say mother who comes to me and tells me that her kid is snoring, they stop breathing at night, and when you examine them, there's nothing. You don't see a significant amount, let's say, tonsillar tissue or adenoid tissue. So in these cases, you would do a sleep study. So the sleep study, again, we do it for 5 scenarios: Down syndrome, obese kids, kids with craniofacial anomalies, disconcordance between the symptoms and what we see on physical examination, and obese children.
Yes.
Otherwise, we don't need to do a sleep study because, again, access to proper sleep labs in Kuwait and worldwide is very limited. And that's why those are based on American guidelines. We only do the sleep study for these patients. And we do them pre-op because we need to repeat it post-op, meaning if I do a sleep study and I have a certain number, when I do the surgery, I should have corrected the number.
Yes.
So that's why we do a sleep study after the surgery.
Okay.
And usually we wait for at least 3 to 4 months before we do.
So that the person or the patient could go back to normality or to sleep normally or to see the difference after the surgery.
This is the thing. It's not because the goal is, for example, a kid, and we call it apnea hypopnea index, meaning that the sleep study calculates how many desaturations, meaning how many times the kid has pauses in his breathing per hour. So usually we treat, if it's like surgically, if it's more than 5. So if a kid has apneas more than 5 per hour, then we need to treat it surgically. So once I do that, then after surgery, I would expect it to go lower. So instead of 5, I would like to see number 3 or 2 post-op. You know what I mean?
Yes.
So I have to have made a difference with my surgery.
Yeah. Okay. Now we did the study. When do you say that the surgery is important? When you eliminated all the associated factors, you eliminated even the emotional and psychological factors. When do you, as a doctor, say this patient needs a surgery?
Right away. As long as the patient has obstructive sleep apnea, the parents come and tell me that their child snores and there are incidences where he stops or they stop breathing, I have to do surgery.
Okay. Now
I don't wait on that because, again, the consequences are important because, again, it affects the development of the kid, it affects their school performance. So you don't wait on these things for children.
Okay. So Dr. Abeer, I have a question. What is CPAP or CPAP?
CPAP, it is continuous positive airway pressure. And this is a modality of treatment to treat obstructive sleep apnea in both children and in adults. However, in children, again, the first line management is to do surgery, which is an adenotonsillectomy. In some situations where we mentioned that sometimes surgery is not enough to cure the disease, then we have to start or initiate CPAP therapy, which is a mask that gives air or oxygen with positive pressure so that it opens the airway and prevents the obstructive events that occur.
Well, Dr. Abeer, I would like to talk more about this subject, but we need to take a break and look into a report, and then we're going to jump into myth and facts after this short report. So please stay tuned. Welcome back, dear viewers, after this short report. And Dr. Abeer, we have myths and facts. Okay, so myth number 1, snoring in children is normal and not a health concern?
Yes and no, actually.
Okay.
So kids who are sick, for example, they have an upper respiratory tract infection, they have the flu, it is normal and expected for them to snore. However, chronic snoring, meaning that the child that snores almost every day, and they have symptoms of mouth breathing, they start developing, the developmental signs that we see and that we talked about earlier, then it is considered something that I have to be worried about.
Okay. Myth number 2, sleep apnea only affects overweight children?
No, false. Again, we see a lot of very fit children who have obstructive sleep apnea.
Okay. Only adults suffer from sleep apnea?
No. All age groups can have these obstructive sleep apnea.
Okay. Myth number 4, children will eventually outgrow snoring as they get older?
Not necessarily. However, obstructive sleep apnea, because it is a serious condition, we don't wait for them to outgrow it. So it's not acceptable to say, well, okay, I'll wait for the kid for another year or 2 years for them to outgrow it, because, again, consequences are very important and are significant.
Okay. Does it return after treatment? Is it possible that these conditions may return?
Yes, sometimes, yes.
Okay. Now, let's jump into myth number 5. Sleep apnea only affects night breathing and has no impact during the day?
True. That's why we call it obstructive sleep
Okay.
apnea, because it occurs exclusively while the kid is sleeping or the person is sleeping. And that is because, again, the physiology that occurs during sleep, when we are in a situation of deep sleep, all our muscles are relaxed.
Yes.
And the airway, let's say the upper airway or the oral pharynx is a muscular tube. So again, it's a muscle and it does relax when we're sleeping. So when it relaxes, and again with the extra adenoid and tonsillar tissue, it might cause obstruction. That's why we see it at night when the patient, or let's say people, are asleep, and from the muscle tone that happens. Again, it's all physiology that occurs during sleep. We see these symptoms.
But can we see it during the day from the heavy breathing and the activity of children?
No, I would not say so. No, during the day, they might have the symptoms of the obstructive sleep. Definitely, like we see them that they're tired during the day, they're not concentrating, but they're not obstructing in the morning or during the day, no. Or while they're awake, let's say.
Okay. Our final myth: surgery is always the only treatment out there.
No, but it's always the first treatment in children.
Okay.
It is the first treatment in children, however, not the only treatment. Sometimes we do the surgery and we still need to proceed with CPAP, as we mentioned earlier.
Yes.
Sometimes we do the surgery and we need to do a different kind of surgery to address the anatomical obstruction.
Well, that concludes our myths and facts for today. So please stay tuned after this short report for our final segment with Dr. Abeer Alali. Welcome back, dear viewers, for our final minutes and today with Dr. Abeer Alali. So I have another question, but also related. Does dental or any other kind of treatments affect that let's say the measures and the standards of the treatment for sleep apnea and snoring in children?
Excellent question. We know that craniofacial differences definitely plays a part in developing obstructive sleep apnea.
Yes.
Because obstructive sleep apnea means literally is the obstruction of the airway while you're sleeping. Part of the airway is the jaw, tongue, and teeth.
Yes.
So if we do have some kind of conditions that causes anomalies or differences in our facial structure, then definitely this can cause obstructive sleep apnea. Therefore, craniofacial or maxillofacial treatments definitely do play a major part in the treatment of obstructive sleep apnea.
Okay, my final question before we end. Can sleep apnea affect the heart and blood pressure?
Yes, definitely. But again, you see that more in adults. However, in children, again, I always say that, subhanAllah, they're protected by Allah. They don't develop that right away, especially normal, healthy children. However, other kids, for example, Down syndrome or other, syndromes might develop these kind of diseases right away. However, normal children, no, but eventually, if you keep it untreated, then definitely they will develop pulmonary hypertension and other cardiovascular diseases. And that's why we don't wait for them to grow out of it.
Yes.
Because again, consequences are very important, whether it was in terms of their development and school performance or on their heart and lungs as well.
Yes.
So we don't wait on the treatment.
Okay. Your final advice for parents regarding their lifestyle and how the parents' lifestyle reflect on the children's lifestyle to maintain good sleeping, for good health, etc.
So again, sleep hygiene is very important for both children and adults. However, we need to make a distinction that obstructive sleep apnea, it is a true medical condition, and it's not related to sleep hygiene, meaning that kids can have good sleeping pattern, they could have a healthy diet, they could have good physical activity, but they still have obstructive sleep apnea.
Yes.
So it's a true medical condition. So it does not really depend on the lifestyle. However, it is also important to keep in mind that a healthy lifestyle means a healthy life.
Yes.
So it is always good to maintain that, to have, in terms of diet, physical activity. So even, I always mention that when I also, talk to my patients, is also the psychological well-being of a child.
Yes.
So that is always important for every aspect in life. But we need to, be aware that even good sleep hygiene does not prevent obstructive sleep apnea.
Well, Dr. Abeer, thank you very much for joining us on DocTalk today, and we wish you all the best in your future endeavors. And also, my dear viewers, thank you for joining us, and until next time, enjoy your day.